Hi, welcome back to Overcoming with ACT with me, your host, Sean Osterlink. And today I wanted to talk about what it's like to join counseling with me and how I format my sessions. So I just wanted to give a description about that. Um, Something I have laid out here in very small writing that you cannot read is the way that I tend to lay out a typical therapy session. So I like to start with just checking in with what's been going on since we last met. So this is usually after the intake session where I've gathered a bunch of information about what's going on and we've talked about goals for treatment. Then once we're in the groove of a regular therapy session, I like to start with like, how are you feeling? How are you doing? What are you stressed about? What's going on in your life since the last time that we met? So start from there. And then, is there any homework? I like to talk about what have you been doing to practice? What are you working on in the time since our last session? Um, that will kind of lead into the bulk of the rest of the session, the process. What do we need to work on today? What do we need to work on in the course of this session? What are we going to talk about? And these things tend to kind of flow one into the other. Sometimes, if there's something big going on, the homework part might get shoved a little later. I like to let sessions kind of flow in the way that they need to go while trying to use this structure as much as it's needed. There's a little thing inside of me that would love to just have everything like really just planned out. I have this like little perfectionistic thing inside of me that would love to just have like this well developed like treatment plan, session plans. Here's what we're going to hit on. Here's where we're going to go. It's like boom, 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 like a manualized treatment course. And the reality of therapy is that really good therapy doesn't typically look like that. There's so much need to be flexible. Therapy is just as much um, an art as it is a science. Um, and so I like to, um, well, move with where the session needs to go rather than rigidly stick to some sort of format and plan for the session. But there is a vague plan here for the session, so that I have in mind and will guide us through typically. Um, I like to bring us around to homework towards the end and wrap things up with some time there in the last 5 minutes and be thinking about what's the takeaway for what we talked about? What do you need to be thinking about from now until the next session? Are there any insights? Is there anything that we need to maybe wind down from? If it was a very emotional kind of session, we might need some time to cool down from that and work through just whatever heavy stuff was showing up during that session. Couples often need some time to wind down, and it's important to take some time for that. And then that brings us to scheduling and just planning out that next session, and then we're done. So that's the way I tend to lay out a typical therapy session, and it's important to me to be talking about homework, what goes on in between sessions, and to have in mind kind of always through the therapy process, what are those goals that were set during the intake. So I'm kind of flexible in the way that I do therapy, in that I move between this directive and non-directive stance. Some people are more directive in guiding therapy treatment. Some people are very hands-off. Um, I often hear things as far as um, that people like my style because I am more directive in speaking into what's going on in people's lives, or talking about activities, exercises, skills, things that are relevant. I like to ask questions over the course of therapy. So I'm not just going to sit here and just be listening quietly through a session. I often use reflective listening because that's a major counseling skill. I'm jumping around from letting people know I'm hearing what they're saying, validating, reflecting back the things you're saying, and adding little things in my reflections so that there's something to chew on, something to think about to help you move along in your process of working through whatever you need to work through in the session, or using particular pointed questions, Socratic questions, to get a different angle on what you're thinking about, to bring up and link back something maybe you've shared before, or something that I know about your history, in order to just find ways to move those gears in order to help you work through whatever the pain is that need to be worked through, whatever the barrier that's showing up to making the kind of progress towards your goal that you want to face. That is how I do therapy in a nutshell, at least as far as what I can think of right now. If you haven't noticed, I'm really enjoying just winging these videos as I think of topics, and yeah, just kind of giving you a kind of feel for what it is like to actually meet with me and work with me. So I'm not aiming for perfect and polished here. In fact, my goal is to not do that. So anyway, thank you for stopping by. There is the gist of how I run a counseling session and just how I show up as a therapist without going into the grit of my theoretical approaches. So, hey, that could be another video. Thanks for stopping by. If you like this kind of stuff, then please like and subscribe and show up again. I plan on doing more videos. So, thank you. Bye.